Today I'm going to show you how to fix your frontal hip pain. What's going on, everybody? It's Blake Bowman here with Gorilla Zen Fitness, and in today's video I'm going to be discussing how to fix frontal hip pain. To begin, the main focus of this video is going to be on correcting something called anterior femoral glide syndrome, which causes hip impingement, okay? And the reason why this video is addressing that is because that is a very common cause of hip pain. I do want to say, however, before moving on to that, the hip pain can also be caused by tissue stress, which I've talked about in my other videos, where basically the muscles and the connective tissue in the area that is kind of inflamed and painful are too tight, and the tightness is contributing to mechanical stress in that area, okay? So what I would encourage you to do prior to this, just to kind of rule that out as a possibility, is get your foam roller out and kind of just smash into the hip muscles with the foam roller. Specifically, look for tightness in the rectus femoris, which is right down the thigh. Look for the TFL tightness, kind of get that foam roller right in this area right here. And also look for the iliopsoas attachment on the femur. I know that's a little complicated. I might make a video about this in the future, but I do want to rule those things. I do want you to rule those things out just in case those are the culprits behind your hip pain. So make sure you try spending, a good, 3 to 5 minutes in that area with your foam roller first. Okay, so now that I touched on that, I'd like to touch on anterior femoral glide syndrome. In order to keep this video short, I'm just going to explain to you what it is, a couple of warning signs that you might have it, and then a couple of corrective exercises you can do to fix it. So to begin, you need to know what normal movements of the leg bone, the femur, actually look like in the hip socket, okay? So there are two motions that you need to know about. One is called rolling, and the second motion is called gliding. Okay, so say that this is your hip joint right here. Okay, this is the acetabulum. This is what houses the hip joint. Okay, and this is your leg bone right here, and this is the top of your leg bone. Okay, this is your leg bone in your hip joint right there. Okay, so what a rolling motion is this. It kind of just rotates and stays in the joint like that. Okay. And this is a very normal motion of the femur in the hip, okay, as is gliding, which is this, if it moves like that, okay? So these are both very normal movements of the femur, like I said. It's important to realize, though, that when you're going into hip flexion, meaning when your knee is coming up towards your chest, they're supposed to be rolling like this, and subsequent posterior, meaning backwards, glide like that. So if this is your knee, as you bring it up closer to the chest, the top of the leg bone is supposed to glide back, and it's supposed to roll like this, okay? Hope this is making sense. Same thing happens in reverse when you go into extension, okay? So when your leg is straightening out or going behind you that way, and it's coming like this, you're supposed to have an anterior glide with rolling like this, okay? So remember, these are two normal movements of the femur in the hip joint. When you develop anterior femoral glide syndrome, basically what that means is that the femur is gliding forward during a lot of motions of the hip, okay? So it's gliding forward when you're extending, which is normal, but it's also gliding forward when you're flexing, when it's supposed to be going back this way, when you're pulling the knee up towards the chest, it's also gliding forward there. And this continuous gliding forward, basically causes impingement because all the soft tissue between the leg bone and the acetabulum gets pinched by the leg bone itself. The joint capsule becomes stretched out and inflamed, and so do all of the other tissues in between the leg bone and the acetabulum. So most of the time people are going to feel this when they are in the bottom of a squat, when their hips are fully flexed, okay? Or if they're in like child's pose or something like that in a yoga class. And you really know that one way to kind of tell that you have this is if you feel that pinching sensation when you pull your knee up into your chest. If you can't fully flex your hip without pain in there, then you might have this. So there are some really complicated tests that you can do to kind of diagnose and find out if you have if you have anterior femoral glide. I'm not going to show those today just because that would take forever. If you want to see a video on that, and if there's enough interest from all of you on that, then let me know in the comments down below. But what I'll do right now is give you a couple warning signs that you might have this, or if you suspect you have it, then these will kind of help confirm your suspect. But one thing that almost everybody with anterior femoral glide has is poor gluteal development. Okay, so they'll have a flat ass essentially. You'll not see very much muscle definition in their butt. Another thing that typically comes along with it is sway back. So their hips, their pelvis will actually be in a posterior pelvic tilt and shifted forward like this. The knees will be hyperextended. Those are a couple things you can look for. Also, this most commonly affects people that are young, under 30, and active. People like yogis get this all the time. People that do yoga, dancers get this, CrossFit people get this a lot, and runners get this. So one last way to kind of confirm that you have this without doing those complicated tests is to perform the exercises that I'll show you in a minute here. And if those help you, then take that as positive confirmation that you have anterior femoral glide syndrome, because if you didn't have it, then these exercises wouldn't provide you with relief. So basically, your corrective protocol to fix this is going to be centered around teaching the femur, essentially, to glide posteriorly during flexion, okay? Because it's not doing that now. It's moving forward like that during flexion, which is causing the pain. You will need a heavy-duty closed resistance band that I'll be using in a second here in order to do this exercise. There's simply no way around it. There's no workarounds. I don't know of any way that you can actually effectively manage and do these corrective exercises without this band, so you need to get one. So the first thing we're going to do is actually stretch the back of the joint capsule in a quadruped position, meaning on all fours. You will need a heavy-duty resistance band for these exercises. A closed one, which you'll see me using in a second here. There's really no workaround with this. If you want to be able to do these exercises, you need to have a band like this. For this first exercise, what you're going to do is you're going to basically get on all fours here like this. You're going to identify which side is the impinged one, which one is hurting. Obviously, you're already going to know that. And that's the side that you're going to do this to. You're basically going to keep that leg down. Okay? You're going to keep that knee down. And then you're going to cross the other one over the back of that calf. And then you're just going to relax here, and you're basically letting the leg bone be pushed up into the back of the joint capsule, which is actually tight, okay? Which is probably contributing to the femoral gliding forward, okay? If the back of the joint capsule is tight, it's not allowing for it to move back, so this kind of stretches it. If that hurts, try this variation with a posterior distraction. Basically, you take your band, you anchor it to something stable, pull that thing up as high as you can, up into your groin, as high as you can go, okay? And then face away from it so it's pulling straight back on your hip. And now try it in that position, okay? What that is doing is it's pulling the femur into the back of the joint socket and making sure that it doesn't glide forward. And this is what we're going to use for the next three exercises I'm going to show you. What we are going to do now is taking the hip into flexion while making sure that the femur is plugged back into the back of the joint socket. Alright, so for this one you're going to wrap the band around the affected hip, take it up as high as you can go. You're going to get on all fours, okay? You want this band directly behind you, okay? Again, what we're doing is we're pulling that femur into the back of the socket so it stays there. And what you're going to do from here is you're going to rock back towards the heels, okay? Only if this hurts still with the posterior distraction, then stop right before it hurts. So if it hurts when you come back this far, then stop just before it, rock forward again. See if you can go back a little bit further each time without causing pain. But I think that what you'll find is that with this posterior distraction, if you have anterior femoral glide, this is not going to hurt at all, okay? And you want to make sure that there's tension on the band during the entire movement, okay? You don't want to be so close to the anchor point that when you sag back like this, when you sink your hips back and fully flex them, that the band goes lax. You don't want that, okay? So you want to get far enough away from it so that there's tension on the band during the entire movement, the entire hip flexion, okay? because you basically need to encourage the femur to stay in the socket. Now another way to do this is supine, meaning on your back. Basically, you leave the band right where it is, okay, right there, lay on your back, keep this leg straight, and then you just pull this leg straight up, just like this, okay? And then you do the same thing as you were when you were rocking back, okay? If it hurts, stop a little early. Make sure that there's constant tension on the band and just pull the hip up into maximal hip flexion, okay? I said a second ago that there's 3 exercises, but these are the 3 exercises. The first one on your all fours, letting the femur push into the back of the socket, rocking back into full hip flexion, and then this supine hip flexion. For each of those exercises, you can do about 3 to 4 sets of 15 repetitions daily. A couple of concluding notes here. 1, avoid any movements that are causing you pain, okay? Including these corrective exercises. Only rock back as far as you can before you feel pain. It should gradually increase your range of motion without pain, but just keep in mind that when you are causing pain, if you have anterior femoral glide, what you're doing is you're probably gliding forward, which is just doing further soft tissue damage and degeneration in the joint capsule. It's causing more inflammation. So every time you flare it up, it's really setting you back like 2 notches. So avoid all flare-ups whenever possible. 2 is avoid doing static stretches for the hip flexors, okay? This kind of motion right here where you get your leg back, I don't know if you can see this, but this motion here where you're putting your hip into extension and you're raising up, you can do this on your knee actually. I've talked about that in my other videos. That's all well and good for most people, but if you have anterior femoral glide syndrome, that is bad because remember, the natural movement of the femur is to glide forward and roll like this when your hip goes into extension, okay? You're already doing that too much. That's causing impingement and inflammation and soft tissue degeneration and damage in the front of your hip there. So don't stretch the hip flexors like that. Okay, it's okay to foam roll that area, but you really don't want to do that stretch. And that's a lot of times that's what people will resort to when their hip starts hurting. They think that their hip flexors are tight, which they could be. But if they have anterior femoral glide and they're doing that in like a yoga class or something like that, that's just really bad, and that's going to kind of just contribute further to what they already have going on. Well, there you have it. I hope that this video was helpful to you. I know it was kind of long, but I really wanted to pack a lot of information in there. If you want to hear me talk more extensively about hip pain, maybe about this syndrome, maybe about more advanced exercises for it, and also maybe more confirming tests to know that you have this, let me know in the comments down below. Like I said, if there's enough interest from a lot of you, then I will definitely make more videos on this in the future. Other than that, if you haven't subscribed to my channel, go ahead and do that right over here. I'm making weekly videos now, uploading Monday and Friday. Also, I'm being very active on Facebook and Instagram nowadays, so I would appreciate a like and a follow on there. I'll include the links of both of those things in the description down below. Other than that, I will see you next time.